Oh, hi there. Come on in. I didn't see you. Hi. Welcome. You must be my 10 o'clock appointment. Emily? Hi, Emily. How are you doing today? Please have a seat. Oh, that's good. That's good. Oh, I'm good too. Thank you for asking. So, Emily, how can I help you? Right. So you wanted to know more about carpal tunnel syndrome? Sure, not a problem at all. Yes, I'm more than happy to help you. Right, I see. So you've been recently diagnosed with carpal tunnel syndrome? Okay, right. Oh, poor thing. You've been experiencing some symptoms? Right, okay, sure. Yep, no. So what I will do, I'm just going to quickly get my book. Not this one, not the book. So this book here, sorry? Oh, thank you. I like it too. It has got this beautiful color and really cheerful designs on it. It's pretty, isn't it? Yeah. Right. So what we're going to do is that I have got a diagram in here on carpal tunnel. Yeah. So I think it's much easier for me and for you when I'm explaining. You could actually have a look at the diagram and we can understand it a bit more better. All right. Now, yes, I've drawn this picture. So this is a picture of a hand. This is the cut section of a wrist, the thumb, and you've got your fingers over here. Yep. So this is the carpal tunnel. Now this carpal tunnel is a narrow passageway in the wrist. As you can see, the floor of it is made up of carpal bones, and as well as the sides, they're all made up of carpal bones. Yep. Now just the roof of the carpal tunnel, you can find a ligament. This is rather a strong band of connective tissue. Now all these forms the borders of the tunnel. Okay, so within the tunnel you would be able to find a nerve which is known as the median nerve. Alright, and you have your flexor tendons as well. Now these tendons are responsible for the flexion of your fingers and thumb. Alright? Now so far are we clear? Oh, that's good. That's good. So moving on. So in carpal tunnel syndrome, what happens is that this median nerve that passes through the passage or the tunnel, it gets compressed. Hence, it has pressure on it and it gives rise to all the symptoms that you're experiencing. Yeah. Now, some of the symptoms that you may have would be things like numbness, tingling, weakness, and pain. Now, that's simply because this median nerve that's being compressed, it is responsible for the sensation and also movement of the thumb, the index finger, the middle finger, and the ring finger. Alright? Yeah? So far we are good. That's good, that's good. So some patients or some clients, they may experience numbness and tingling, which is mild, while some of them may have pain even carrying out very normal daily chores like probably reading a book or carrying a cup of coffee. Yes, so it really does differ in that sense. Usually you experience the symptoms at night. Yep. Sometimes as the symptoms or the syndrome progresses, you tend to have the pain all throughout the day. Yeah. So far you clear, Emily? Oh, that's good, that's good. Right, let's have a look at the causes of it then. So, some of the reason why this median nerve can get compressed is due to the thickness of the tissue that surrounds the tendons. Yes, once they become swollen and they thicken, they will then compress this median nerve, giving rise to all the symptoms that you're experiencing. Yep. Some of the causes? Sure. Now, some of the causes that are there would be things like repetitive hand movements or wrist movements. Yep. It could be due to some medical conditions like diabetes, rheumatoid arthritis, thyroid problem. Yes, some people, they're born with a small carpal tunnel as well. Yes. Yep. In some cases it's funny, but you don't really have a reason for why it's happening. Now that's termed as idiopathic. Yeah, idiopathic. So that simply means that there's no reason for why a patient is experiencing such symptoms. Yeah. Okay, so far we are good. That's good, that's good. Right. So you are experiencing some numbness and tingling sensation, I see. And you mentioned that you've already met the doctor, so he must have done some tests for you. Right, he was tapping. Right, he was tapping on the nerve. And that gave rise to a tingling sort of sensation? Right, I see. Okay. You'd be going in sometime next week to see the doctor? Uh-huh. Okay. And just to go through your treatment options. No, that's good. That's good. Most of the time you have surgical and non-surgical treatment. So if it's non-surgical, simply means that there's no surgery involved. They would advise you to have a wrist splint. Yeah. Splinting, yep. It's usually done at night just so that it keeps you from bending your wrist while you sleep. Yeah, and it keeps your wrist in a neutral position as well, just to avoid the pressure around the median nerve. Yeah. Some doctors may prescribe medications. Yeah. This is, just keep in mind, this is to relieve the pain or the inflammation that you're experiencing, but it does not target or help with the cause of the carpal tunnel syndrome. Yeah. What happens if all this non-surgical treatment doesn't work? Right, that's a really good question. So, if it doesn't work, then surgery would be the next thing. Yeah, no, don't get scared. Yes, no, don't be afraid. It is a simple procedure, and I'm sure the doctors who are going to be doing it, they're well experienced in it. Yes. So what they do is that it's called the surgery, it's called the carpal tunnel release. Yep. So the goal of it is to relieve the pressure on the median nerve. So one way to do that is by cutting the ligament that forms the roof of this carpal tunnel. So when you do that, it will increase the size of this tunnel and it will decrease the pressure on the median nerve. Alright? Yes, I think you should do that. You should go ahead and see your doctor and go through your treatment plans. Yep. Yes, take it one step at a time. Okay. So Emily, so far are you clear with what we have gone through? You are? Oh, that's good, that's good. I'm happy to hear that. Okay, not a problem. Anytime if you need any information, please come in to see me. I'm more than happy to help you. And Emily, I just want to wish you all the best. Yep, with your doctor's appointment. I hope all goes well for you. Bye, see you. Well, that went well. Right. Let's see who's coming in next. Peter, right, Peter. Let's wait for Peter to come in. Meanwhile, let's go through or repeat some of the words that we have gone through today. Flexa. Retinaculum. Thumb. Fingers. Wrist. Nerve. Median. Splint.